Es un placer estar aquí con ustedes, and it's so nice to have Sergio present many very important issues that I would like to talk about too from the standpoint of drug abuse and addiction. Let me know si me pueden escuchar bien con estos micrófonos. I had to put two of these on, maybe because I'm bilingual, so one microphone will get in español y otro en inglés, so we'll see how that goes. A ver si no me confundo. A few pochismos that go in as well, you know. Actually, coming here to El Paso, you know, it's fun. It's very interesting to hear Sergio speak, and también Hector, muchas gracias por la invitación, un gran amigo y compañero. When I was hearing the history that Sergio gave, I said, I need to share my own history because it was March 11th of 1954 that my familia, I was the oldest, I am the oldest, came to El Paso. My father was a bracero and worked on the railroad and did many different chores. I was born in Mexico City, and so when I was just before 3 years old, my family came to El Paso. It was the day after my next sister, Alicia, turned 1 year old. She was born on the 10th of March. So there is a history of having El Paso really being El Paso for my family coming to the United States. And I think that there's an interesting context that so much of our lives are based upon early events that you can never know when they're happening, how significant they can be for you. But ultimately, this was a very significant paso for my family coming to, we wound up growing, I grew up in the Los Angeles area, a place called El Monte, which was known for the oldies but goodies, Art LeBeau and the oldie but goodies at the El Monte Legion Stadium. So there was a lot of that I grew up with. And it was a combination of being in a very poor Mexicano community and growing up in a lower class, lower middle class community. So just like with Sergio, it's such an honor and a pleasure to be here to speak with you because so many of those kids that I grew up with, Mexicanos, didn't make it as far as I did for many reasons. And we make jokes about, no, pues es que eras pues muy listo y que conocías bien y te llevabas bien con la gente. You know, the kinds of things that we think of, que la gente que se porta bien. But then some people have said, la razón que porque llegaste aquí es que porque es güerito. Eres güerito. And they thought, no, pues está muy bien él. And what if I was very dark? Would there be a different situation? We don't know, but you do get in touch with issues of discriminación and other issues that can be very subtle messages whether you are okay or not okay. And I want to talk about some of those issues as we approach issues of substance abuse from the standpoint of there is no one trajectory, as you know, on what causes substance abuse. I'm asked to talk to the media every now and then, why do kids do drugs? And the issue is there's no one trajectory. There are a few, however, that we need to understand because there are different ways in which kids experiment with drugs, transition to regular use, and then ultimately move on to abuse and ultimately dependency. Oh, this fell off again. Here we go. Boy.
That was an English one.
The English one fell off. Thank you very much. Appreciate that. Well, let me get started. And what I would like to do, as we said here, I have lots of information I like to pack into my presentation, and I don't necessarily go through every bit of it. But as you can see, a little hard to see there, I think you're supposed to be receiving the presentation to save the file to save. But if you have any follow-up questions, feel free to, let's see, here we go. This is a little hard to see, but this is my email address. Feel free to send me an email, and sometimes it takes a little while, but I'm happy to respond to you. Okay, and this is, of course, the presentation today. Let me begin with this notion of emerging concerns. And again, I'm so glad that Sergio presented some issues from the standpoint of mental disorders. And as we know, from the DSM-4 and whenever 5 comes out, mental disorders, well, substance abuse is considered a variant of a mental disorder, and we talk a lot about co-occurring disorders. You can have, of course, cocaine abuse in someone who is depressed, or schizophrenics who have a tobacco addiction. So you can see that, in fact, you see that, I think it's more the rule than the exception. So let's try to understand a very interesting and important and disconcerting growing trend as it relates to our Latino youth. We found out, although this youth risk behavior survey, has data from 2005, it was really published 2006, 2007, so it's more recent than meets the eye there. Newly emerging rates of problem behaviors, including substance abuse, reported. And this is with Latinos. I'll show you the rates in just a bit. Relative to the past and compared with their same-gendered peers is important because substance abuse, as you know, for many years has been different for boys than for girls. And so we want to compare Latino boys with African American, white, non-Hispanic boys, and then we do separately for girls, although things are blending, as you can begin to see. So in Latino adolescents recently exhibited elevated rates of substance use, depression, and suicidal risks. Some of the points that Sergio echoed earlier. And let's take a look at some of the data to understand the nature of this problem. What I did here is these are the responses, survey responses to questions, and I've simplified them here to the question, how often has it occurred for you? Felt sad and hopeless, seriously considered suicide, and then even more extreme, attempted suicide. So these are conventional questions that you can ask. What are the rates of someone saying yes, true? Certainly when we look at gender, we can see that there is, and this is regular in the mental health field, right? The rates of feeling sad much higher for females than for males. Seriously considered suicide, same thing, higher for females versus males, and even suicide attempts for females. So the first thing that we know, and this has been going on for many years, depression and suicide are a bigger basic risk for females than for males. Although what's the other pattern? In terms of a completed suicide, men are somehow able to do it more successfully, unfortunately, because of the methods that they use. So with that as a backdrop, what are the rates now when we disaggregate the data by Euro-American, or some would use the word non-Hispanic white or white American, versus African American versus Latino? And I highlighted Latino because that's the group of focus here. And what I did is included in color those colors that are either reddish or pink or orange. Those I put in as higher than average rates compared to the others. And what we see very clearly, and you can compare, well, let's just do some of that. For males, the rate is higher here of felt sad and hopeless. 26 is higher than 19, which is higher than 18. So you can see versus white, Euro-American versus African-American, Latinos are higher. We see the same in terms of attempted suicides, here 5.2, 5.2, and 7.8. Now, these are raw rates, and they haven't gone through a more refined statistical analysis to look at whether these are statistically significantly different, but we can see that at least they're higher, and some are much higher. Let's look at females. Here, if we compare Euro-American girls, 33.4, African-American, 36.9, Latinas, 46.7 for felt sad and hopeless. Seriously considered suicide, 21.5, 17.1, and 24.2. And attempted suicide, 5.2, 5.2, 14.9. Now, a concern here is that these rates were not seen 10 years ago. And in fact, we wrote an article many years ago that basically looked at similar data, and the rates of substance use with Latino adolescents, for Latino adolescents, males and females, quite a bit lower than for white non-Hispanics. So what we're starting to see here is a trend, or a pattern at least, but I think it's a trend, in which a new generation of Latino adolescents, both male and female, are starting to show some negative effects of whatever is happening to them. And Sergio suggested this, that maybe the second generation is going through some very difficult growing pains, and we're starting to see that translated into these forms of emotional distress. Let's move on to another area. This is cigarette and alcohol use. And I won't go into such depth, but you can see the progression, and I just want to call to your attention, here we have the rates that are visibly higher. For lifetime cigarette use, boys higher than the other groups. Also in terms of lifetime alcohol use and current alcohol use. So these are remarkably different than their peers, and for girls here for lifetime alcohol use, higher. So we're seeing tobacco and alcohol that were not in the past seen as particularly high for Latinos now showing up. Yes?
Are these adolescents under 17 or these adults?
These are adolescents. They are under 18. And so I should have double checked the age range for these, but these should be around 12 to 18. And we know in those years that the rates go up very quickly, so it is important to identify the window of time. But in summary, these are adolescents. So we're seeing something unusual happening in the very recent past. When you say, well, cigarettes and alcohol, those are legal drugs. So, you know, you can see that access is there. What about the illegal drugs? Well, this is what also sounds pretty distressing. This is for, here you see the different choices: lifetime marijuana use, lifetime cocaine use, heroin use, lifetime methamphetamine and ecstasy. Latino males leading the pack on each of those. And for females, not quite the same, but also distressing. So something, again, in conclusion, something is happening to our Latino youth that did not show up a decade ago or beyond, and we need to understand the changes that are occurring in terms of the different causes that are leading to these results. Now, as we get another round of the Youth Risk Behavior Survey, maybe the rates will go down, but the concern is we don't think that there's any changes in the social structure that will make them go down. If anything, they may stay the same or go up. So where do we go from here? Clearly, substance abuse prevention has now been, the need for that has been laid on the doorstep of the Latino communities because of these numbers, which are national data, so we need to see regional differences. But again, these are big numbers to be concerned about. Question? Yes, sir.
On your previous slide, when you show the onset of tobacco and alcohol use and the general prevalence, and the attitude is, well, these are legal drugs, like you mentioned.
Yeah.
But from a behavior point of view, what's causing the need to change the behavior, or to change the mood? You know, why are they using substances to cope with whatever's going on around them? That's the key issue that will later on be answered as to whether there's a dependency issue, right?
Yes, absolutely. What's the underlying process? And I think we have to be really concerned because if we said these are use rather than abuse, so you say, well, they were just using, they're going to stop, or at least many will. But then when you add that to this slide, there is an underlying deep emotional disturbance going on, at least as measured by depression and suicide risk. So we have reason to believe that these co-occurring pieces are pieces of a bigger process where young Latino adolescent male and females are becoming very distressed over something. They're turning to alcohol and cigarettes, and more than that, they're turning to hard drugs. Now, as use data, we don't know that this will develop into abuse and then into dependence, and a lot is determined by how early they start. But we already see, again, so there's a limit to how much we can project from these data. But what we can say is that these numbers are something to be very concerned about. And indeed, if the underlying process has more emotional disturbance below it, then we shouldn't think that it's going to go away immediately. We have to deal with the substance use and abuse, but we also have to deal with the underlying emotional problem. So this is a starting point for saying we do have concerns that have to be addressed. So in summary, this is just reiterating the long list that we now have to contend with. Latino youth now exhibit remarkably higher rates on all of these. So you could see that there are 11 areas, or the different substances. Not all youth are poly drug users, but there's enough of a range of problematic behavior in Latino youth that we must ask this question, which is what cultural, social, familial, individual factors may have changed within the past few years to produce these elevated rates. I guess as a question, does anybody venture to have maybe one or two thoughts? What may be going on, and maybe even here, that could be possible reasons why this is happening very recently? Yes?
Parents are working and they're not occupying themselves in their children. They're more worried about having more money for the household and leaving the children to their own issues.
I think that's an excellent point. Both parents working, they need to pay the bills, they need to take care of things, and no one, or at least not enough folks monitoring. We'll talk later about parental issues, the intervention approach we're taking, and parental monitoring is a critical factor in making a difference in protecting our children from drug use. You got a follow-up or another comment?
Yes, and I think society now is more concerned with materialism, about getting the new cell phone, and that's how parents, they feel guilty that they don't spend enough time with their children, that they're actually thinking, well, I'll buy them this, I'll buy them that, so the children won't really ask for their time, they'll just be satisfied with having something new.
Well, that's another piece of the issue, another hypothesis, that a greater materialistic approach is eroding the quality of the parent-child relationship because the parents may feel guilty, so instead of spending time with their children, they buy them whatever the latest is, latest iPhone or whatever the commodity is, and that's supposed to be a thing, and it's not. Another thought, yes?
And another good tie-in to the first presentation is I think a lot of people think that because you're of a certain culture or color, that certain problems come with you. But we saw the difference in people that were native born to Mexico, people that are second generation and third. So it looks more like it's geography and where you're growing up and the environment than it is inherent to the actual people.
Well, yes, absolutely. And you see, well, Sergio, Dr. Bill Vega, and Sergio did the classic work in showing how immigrants come pretty healthy and they get sicker as they spend more time in the U.S., which raises a very interesting question, which is not an easy question to answer, and the answer is not necessarily the one that seems logical. If coming to the U.S. and acculturating, and how do we measure acculturation by speaking English, then therefore that's bad for you. So what's the solution? Diles que hable español. Que hable español y así no se enferman, right? Well, it's not that easy. It's not quite. But what we see in acculturation is a process that is very important that you integrate into the society for the purpose of better jobs, better living situations. But you also have to be worried about the integration can have a price in terms of family structure, in terms of changes in values, and those are the complex issues we need to understand. And what I'm using now is the term adaptive acculturation, or healthy acculturation, which means, of course we want you to learn English. Of course we want you to raise in your social class. Por eso viene la gente. They want a better life. So we want a better life for you. But you need to know how to navigate the system in a way that you get the better life, but you don't give up the things that make quality in terms of the quality of family life. And these are the things we need to understand better. I think there was a couple more. See.
I just wanted to say that a lot of honesty with parents is that it's a norm that the alcohol already at home. Parents come home, they want to show that a way to relax is by drinking alcohol, and the alcohol is already in the refrigerator. And who the parents send are the kids go bring the beer. So a lot of the stuff is already being promoted at home.
Yes, and we need to sensitize the parents. I'm sorry.
We're sending out mixed messages.
Yes, we are right. We need to sensitize parents that it's not a good idea to do these things, to send your child to study with colleagues in San Diego. send the child to go get matches. You know, you can go and take them from the store or wherever, and then light your cigarette for them. So the next thing you know, the child is learning all these skills for how to smoke. Or in fiestas, you name it, quinceañeras, birthdays, celebrating Cinco de Mayo, which I think is more celebrated by the Americanos than Americanos, but, or call it 16 de septiembre. But what you see in some is that there's a toddler coming by the table, and then they say, oh, let's just give him a little sip of beer, a ver si se emborracha un poquito. And it's kind of funny there, but what they're teaching the child is how to savor beer. And then what's the first response? The baby, they go, it's bitter. But ultimately, if they do that a lot, then the child kind of knows that when the party's over and there's a bunch of beer, we'll go have some. Isn't that what happens? So we need to sensitize our families that it's kind of funny, but then you're opening the message, like you said, that this is okay. And it's not okay for a 5-year-old to drink beer. It's not okay. And another question, yes?
I think the longer we're here in this country, in generation, I think the more we move away from what are typically our traditions.
Yes.
And so, the family starts to break apart, starts to stretch, and you don't have, in the case of two parents working, migrant people, they work in the field, both parents work, so they carry the kids with them, and everybody played a role in turning the baby good.
Yes.
Now, we're putting our kids in daycare to strangers. Hopefully there's Hispanic people there that can kind of emulate parents, stuff like that, but we don't have the grandparents, we don't have other extended family members that are an integral part of the family system to shoulder some of the burden of raising kids.
Absolutely, yes. In other words, the family dynamics are changing more towards individuality, whether desirable or because it's a necessity, working more hours and disconnecting what we call the quality of the parent-child relationship, the bonding, el cariño, is being eroded in some ways that I think is one of the underlying mechanisms that's leading to these patterns. We need to show that it's really true, but we suspect that it's a whole bunch of family issues. So I do want to talk about what we're doing with parent training of low acculturation Latinos and Latinas, that is moms and dads, to bring these issues to their attention and see how we can at least reduce the risk of drug use in your kids. Okay, moving forward. Some slides are busy. I don't want to go through all of these, just to make a point or two. Yes, there was a comment, question. Yes. Yeah, this is data for U.S. residents, Latinos and Latinas. Well, of course, these are not my data, but they included those youth that were sampled in various, all the states of the U.S. It's a nationally representative sample. It doesn't have youth from Mexico, so it would be an interesting comparison. An excellent point, and these are not broken out by years in U.S. or immigrant versus native. But I think I go back to the work of Bill Vega and Sergio Aguilar Gaxiola and other colleagues, that that gradient shows up in various ways. So there's reason to believe that these let's put it another way, depending on the proportion of immigrant youth that you have there, those are the averages for all of them. But what it would suggest is that if you took away the immigrant youth and looked at the native born, those rates would be even higher for those, if the same process is occurring. And that data is not available disaggregated that way, but it would be very good to look at that. Yeah, you have one.
I just wondered if you did any retro studies for, like, the kid from Ireland moved over,
good question. Have we done some retro studies looking at people that came from Ireland or for other parts of the world, and how that pattern that we see in Mexicanos might have shown up? I have a few cases of immigrants from other countries, although it's a very small sample, and we can look at those cases to see how things might have changed. But those are interesting questions to look at in a bigger and more formal study where you can see if the same process of, let's call it family disintegration and an increase in substance use occurs in other immigrants as well. I would suspect that if immigrants come from a country with low prevalence rates of substance abuse and they come to the U.S., that you're going to see in a short time an increase. And why is that? Because our U.S. culture has ingredients or conditions that, whether indirectly or not, promote higher substance use for a variety of reasons. Now, we don't have to go too far. Tobacco industry, tobacco ads, liquor ads, they promote use. And of course, they're supposed to be for adults. But many ads, as we know, at least in the recent past, had youth content. And until a lawsuit stopped it in the tobacco industry, couldn't do that anymore, at least on TV, or at least on billboard ads. But they still find other ways to do it. With illegal drugs, it's more complicated. But I guess the issue, and I'm glad that Sergio mentioned, that U.S. is a consumer society of a whole kinds of drugs, both legal and illegal. And as a result, the conditions that promote that are the conditions that are going to change how immigrants consume substances. Okay, let's move on then. This is a very busy slide, but I just want to highlight the issue. What are the most effective interventions in drug abuse prevention programs based on scientific evidence that they work? I think it's very important that we test, of course this takes time and effort, that something really works, because we don't want what some folks have called activity traps, where you do an intervention, it doesn't really help, but people kind of think that it does, and that's supposed to be a good thing. But in the end result, if there's no evidence that it works, then you don't know that it's really efficacious. Very important term. And so we do need to test these things out. I mean, why would you want to take a medication that's a placebo and everyone feels good about it except it doesn't cure the disease? We don't want that. Well, we can't have that either in drug abuse interventions as well. I don't want to go into great detail, but just want to share with you that the old style view of drug abuse, I guess interventions from the 50s was information. Tell kids that drugs are bad for them. They'll be so frightened that they will never use them again. What do you say that? Is information a way to prevent drug abuse? No, you don't want to do that. But it's put up here as something which is the easiest thing to do. Make a pamphlet, give it to the kids. Or have an assembly and have somebody, a testimonial saying, I did it, it was bad for me. And the kid will say, well, it was bad for her, but I will never become an addict. I have done literally, I've done dozens, maybe hundreds of interviews with addicts through our study and others through the years. And I can't remember one instance where the person said, when I started doing drugs, my goal was to be an addict. Because I really want to be an addict, I mean, you work your own hours and you don't have to go to work. It's a great occupation. You meet interesting people in prison. Wonderful. I have never heard that. But how many people have I heard that said, you know what? When I did drugs, I think it's going to affect me because I'm different. I'm better than those guys. And then, now they're saying, you know what? Because of drugs, I lost my wife, I lost my home, I lost my job, I lost everything, I have a prison record. I wish I had done it. I have heard that story a lot. So we know that the progression is a very negative one, but information, again, is not the thing to do. These are other things that seem to work. Decision making, help people make rational choices. Pledges. I pledge not to smoke. Values clarification, what's important in life. Goal setting. My goal is to do something and it's incompatible with drug use. And stress management. What we know is that these are a bit more hands-on, but all of these are not strong interventions to avoid drug use, to prevent it. These are some others, and this is an interesting one, self-esteem enhancement. Many years ago, people felt that by helping kids have higher self-esteem, they're going to be feeling good about themselves, they won't do drugs. And the evidence is mixed on this, but the view now from research investigators is that that's not really the way to do it. Now, you can increase self-esteem in relation to other things, but if you just put all your eggs in that basket, you do not get an efficacious intervention. What are the more efficacious? Resistance skills training, life skills training, which is very similar, and some of it in norm setting, that what are the family or school norms around whether it's okay or not okay to do certain substances. These are not that useful, but they're adjuncts, assistants and alternatives. They kind of help, but they have to be part. The take-home message is you have to have a complete package. But don't rely on information alone, because that's not going to do anything. I mean, and particularly now, we have such an information overload, it's hard to remember anything. So why would we believe that giving information to kids alone is the cure? On the other hand, information along with other things is okay. So you have to put it into the context of an entire package which is efficacious. What I'd like to do now is, there is an article, let me go to this, that came out recently, and we did a very in-depth review, and I just want to mention a little bit of how we did it. And if you're interested, just go to this source. Myself and Manuel Barrera, Hilda Pantin, Charles Martinez, Maria Felix Ortiz, Rebecca Rios, Vera Lopez, and Christy Lopez. All of us worked together, and this is an article that came out in Drug and Alcohol Dependence, which is a well-known large journal, and it's going to have much more detail than I can present to you today. I'll present some highlights on the issue of how do we approach having an efficacious, that means a program that really works in the community or in schools that will prevent substance use in kids. And so this was a review of literature, but it's a basis for the work we do today. In summary, what we did is we did a lit search from 1974 to 2003 using the words drug abuse, Hispanic or Latino, in different ways to generate articles, and we found 518 in that window of time. So we thought, wow, there's a lot of information here, evidence. When we broke it down into reducing it and sorting it, we found that there were only, unfortunately, it began to break down, there were only 35 articles that we could sort into these categories reliably, from conceptual information or review of literature, 2 case studies, 3 naturalistic studies like, surveys, surveillance that are more epidemiological, 4 correlational studies, which are similar to these except you look in more depth at the relationship between different variables, then 5 non-experimental interventions, and 6 randomized control studies. From this, more rigorous studies, we only were able to get 18 articles. So you see how, like a funnel, it dwindled very quickly in terms of the quality. 18 articles reviewed, and I double-checked, it's from 3 categories. So from these, we had 18 articles. Not a lot from what we thought we had, but we looked deep into what these were telling us. I want to talk about 2 kinds of programs, and they go back to this. I'm basically going to focus on the non-experimental interventions and the randomized control studies. This is the studies that give us the strongest evidence for what are the ingredients or the process by which a program really works. These I call broad-based programs with weak experimental designs. And we reviewed several of them, but I just want to talk about 2 to illustrate what they look like. This is in an article by Hernandez and Lucero, 1996. And it was the Denver Area Youth Services La Familia Community Drug and Alcohol Prevention Program, family-centered, and it focused on youth 6 to 11 years old, so early risk and years and beyond. The program emphasizes building cultural strengths, which I thought, great, really good. Culturally relevant protective factors, and featured family communications and problem solving. So the strategy is a very good one. The problem was they had limited outcome data, so you really didn't know clearly how it worked and with which outcomes on substance use and other outcomes. So that was the big limitation. It might have worked, but we don't have the evidence to show that it did based on the way they set it up. They also did not have randomization, which is a critical issue scientifically. It's a hard issue to do in the community. It can be done, but it's got to be done very carefully. So here again, you didn't have definitive evidence that it worked, even if they had strong outcome measures. This is a second one, but it's in the same vein. The Perth-Amboy Community Partnership for Youth, Guillermo Molina and Gorman. They use Paulo Freire's model of community consciousness, and I would surmise several of you may be familiar with Paulo Freire's work. Anybody? A couple of you, huh? Okay, and isn't that the idea that you educate the underclass, los pobres, in ways to think through and understand the root causes of their poverty or other problems, and so it's through a dialogue. In fact, we did this many years ago in Mexico in a meeting in Chiapas, and it was very interesting how we got people in round tables and they discussed the roots of their problems. So you can do that, and I thought this is great to have that program, that approach. Program featured family cultural adaptation to American society. Again, very good strategy. Counter-marketing strategies, yes, you need to teach kids how to argue against ads that they get from the tobacco industry and life issues in an economically disadvantaged environment. So the planning is good. But unfortunately, this had better outcome information. Intervention did not show changes on targeted outcome measures. Did aid in the passage of a local ordinance to ban cigarette smoking. So something good came out of it. But in terms of how the program was designed, it did not work. A big question is, why didn't it work? You know, you have some neat ideas here. Didn't work. Any thoughts? Why would it not work, despite the fact that there were some neat ideas here that ideally, you know, could have been implemented well? Well, let's move on and then see what might emerge. So, in summary, these were 6 non-experimental intervention studies aimed to reduce the risk of substance abuse via participatory education. That's a good thing. Get people engaged in their own learning. The principle of involvement, of participation. Community empowerment, that's a good idea too. We want the communities to have the resources or develop the resources to decide their own destiny. We want that. Promoting community involvement, yes, we want community members involved. Building youth self-esteem and self-confidence, not a bad thing, you know, within the context of other interventions. And family strengthening, a very good thing. But in summary, the disappointing result for these and others like them, broad-based approaches were compromised by diffuse implementation. And I've seen this in other smaller efforts too. The process or the way that the program is presented has to be done in an organized way. If you go in many directions, it's, you know, you move in too many different directions and you don't do it in an organized way or organized enough. At the end of the pipeline, you don't get the effect you were looking for. So you have to avoid diffuse implementation, weak or limited program effects, well, that was the outcome, on targeted but ill-defined outcome measures. So the measurement was not good, you couldn't document. Long story short, these are promising programs that didn't work. So we need to avoid this because otherwise we go to the community, we promise something, and then we have to say, you know what, it didn't work. Not so good, so what could be done? These are the randomized control group studies, and they're different, and the big factor is they're more rigorous, which some would say, well, why do we have to do that? Well, it's part of focusing the intervention as well as focusing the measurement so that you can know that it works, but more than that, that you show that it works. So that's very important. There were just a few, 5 articles on 4 different controlled community-based trials, and 3 recent studies that we added that actually were the most important ones. So we just had very few. But these studies that tried to look at various things, they focused either on substance abuse prevention, improving parental skills, or family strengthening. And those are the focal points that go with these different programs. So let's take a look at them. These are programs that we can say they did work. And my question to you is, so what's the difference? How did they either organize or implement differently that allows us to have evidence that they did work? So I want to talk about 2 of them, and we're kind of cousin programs. In fact, that's an older brother of ours currently. This is the Familias Unidas, and this is a family-sensitive intervention developed by Hilda Pantin, Jose Chapoznik, and the other folks in Miami that have done the pioneering work in both the clinical treatment of substance abuse with Latino populations and then also now community-based approaches. Direct parent training is a core feature here to ameliorate adolescent behavioral problems and to decrease the likelihood of youth problem behaviors, including substance use and abuse. So they go through the family, which is, of course, the key way that they develop their earlier interventions in the clinical setting. Familias Unidas has several focal points, and I'll just mention them briefly. As you know, the key approach in the drug abuse prevention arena is the risk and protection approach. That is risk factors, protective factors. What we want to do, the strategy is what? Decrease risk factors and increase protective factors. If you put them together, you're going to have a better chance of doing things well. So protective factors, what did they identify? Familism, which is a fancy term, and it's kind of the same, family cohesion, strengthening families, very important. Parental investment, you can't strengthen a family if the parents don't get involved with your program or with the schools. Although actually in the work that we're doing now, many parents say we want to participate in the schools, but the schools don't let us. They don't invite us in. So we have to deal with the schools to say, why don't you invite the parents? And then the schools say, because they don't want to get involved. So who do we listen to? Who do we listen to, right? Also other things, parent-adolescent communication and parental monitoring. Both very important pieces. And positive parenting. What is that? Positive parenting. So those are the protective factors. We want to build those. And we want to take away or reduce the risk factors, family conflict, differential acculturation, and lack of parental monitoring. So this kind of links to the top here. The parents, this is Familias Unidas. Parents participate as agents of change. In other words, the therapist, the interventionist, can't make the difference if the parents don't take that information and use it at home. So the parents are key. So we need to increase parental involvement in program and in social systems like schools and others, and foster parenting skills. This is a busy slide, and it's not actually in the article, but it just shows the approach, and I won't go into detail. You could take a look. And if you have questions, send me an email message, and I can elaborate on a particular question. Or later, if you want to go back, we can look at this model. But basically, the way that this model works is we talked about major risk factors, and then there is a targeted area that we just discussed about the parents, what you want to do. So you have an intervention that is really an expression of these different types. I didn't go into this in detail, but it's a selective program, culturally adapted and tailoring, meaning that it's a program for youth at initial risk, not just a universal program for all youth. It's for kids that's starting to show problems, and then you do the parental training, targeting these skills, and then ultimately the outcome is increased parental investment, decreased youth problem behavior. So it's a very simple, well, it's got a lot of stuff, but it's a simple model. It's this is how it's supposed to work. So Familias Unidas was efficacious. After, at the end of the pipeline, you see, did it work? The answer is it did. Efficacious in increasing parental involvement and in decreasing adolescent behavioral problems. So it did what it planned to do, so it was efficacious. And did not, however, nothing is perfect, did not improve adolescent school bonding or academic achievement. It wasn't the focus, but ideally you should have seen that, but it didn't work. But we have evidence of a program that did what it was supposed to, it worked. I want to share one more, and this is closer to home. This is the project that I'm involved in, and I'm in charge of the parent component, which is an addition to the original Keeping It Real. And this has been also shown to work by the same process of randomized controlled trial in the schools. This is a 10-lesson culturally grounded prevention intervention developed by Michael Hecht, Flavio Marsiglia, and others at Arizona State. So I didn't develop it, but I'm now part of the team where we're trying to bolster it by having parental involvement in what we do. Promotes anti-drug norms so that the kids see that these are messages from the outside that this is not good to do drugs. Resistance and social skills, meaning that they are able to deal with situations where they're confronted with the chance of doing drugs. What are the skills to say no, not just don't say no, but know how to say no and mean it. And that's what we do with the kids. A media campaign and it offers booster sessions because you need to remind the children of the skills that they learn, but they can erode unless you have a booster session. So that's how it's set up. This is a busy slide, and it talks more about the details, so I don't want to go into great, other than to share some highlights. The four skills that are taught, they're interrelated, is refuse, explain, avoid, and leave. Very simple and in order, and that's what youth practice, so that they can be successful in avoiding situations or getting away from them where there's the chance of doing drugs. And the focus has been alcohol, tobacco, and marijuana. Steve Koulis and his team now have a paper, and if you're interested, it's in Prevention Science, 2007, that gives more detail on this information. Keeping it real was effective in preventing gateway drug use with strongest effects in alcohol avoidance. We see the numbers, they literally either went down or they stayed stable. And that's prevention because, as you know, as adolescents get older, it keeps going up. So if you can keep them stable across time, that's prevention. Effects also on improving social norms and resistance strategies. So what it targeted to change, they succeeded in doing it. Less influence on these other cognitive factors. Cognitive variables like self-efficacy, intentions to accept drugs, positive expectancies. Kind of the thinking wasn't changed as much as the behavior, but at least the behavior was key in keeping these kids away from these substances. An interesting side note that goes to some of the discussion we had before, keeping it real was efficacious only for the most acculturated, mostly English-speaking Mexican origin youth. The least acculturated, mostly Spanish-speaking youth, such as were at such low risk at baseline, even in the control group, the ones that didn't get the intervention, that the group did not initiate drug use at applicable levels during the 7th and 8th grades. In other words, here suggest a naturally occurring set of protective factors that are worth exploring in future research. That, in other words, even the kids that are low acculturated, that are new immigrants, or, well, usually the new immigrants, had low rates across the board. So even in the control group that didn't get the intervention, the rates stayed low. So we think that there's something protective in the families in the early immigrants. But as we know, when they spend time in the U.S., they right down. Okay, let me pause here. I'm now in part 3 of 5 of them. Any questions or comments regarding what we've had so far? We've tried to make the distinction between the programs that were really great ideas but they didn't work, and the programs that build upon existing and also get great ideas but they were shown to work. So we've got that distinction. So now we know the pieces that are useful, we need to implement them well. Comments? Yes?
Are you familiar with the Strengthening Families curriculum of Iowa?
From Iowa?
Strengthening Families?
Not that one, but you know, Strengthening Families was SAMHSA, CSAP, Center for Substance Abuse Prevention initiative across the board. So several sites had Strengthening Families. The one that I know better was Placentia Bosniks and also Carol Comfort in Utah. And she's one of the leading people in Strengthening Families with Native American and American Indians. So I would surmise that this one may have some similar features.
And it's very similar also to that program we were discussing. We used it in New Mexico.
Okay.
And it's very successful because we did incorporate the parents, and they actually attended, and we had them doing skill building and that kind of thing with the child there. And it's with different ages, starts from, I think we had like 6 to 9 year olds and all the way up. Very good program, and it's very similar to the kids.
Yes, I think what's happening, you know, through initiatives through the SAMHSA centers and also through NIDA, to some extent, AAA, and NIMH, we see recurring patterns because people discover what works and they begin to use it in a variety of settings or in various programs. But that's really good because we know, well, what becomes evident, the family and the parents are critical. Without them, you can only do temporary prevention, but then the kids will go off and ultimately try. So we need to get the parents involved.
You know, and what worked most in that program was just the fact that we didn't deny that the kids were using drugs. We actually monitored them every day. We had a diary where they entered how much they smoked or drank over the weekend.
Okay.
And then we could reduce that.
That's very good because that's part of the monitoring. Well, let me pick up the pace a little because the time goes so fast and just give you some highlights here. Can we strengthen families and promote healthy family function, which is the other measure that we have? Does the family function do well or fall apart? And so these are various approaches that I won't go into that are part of the thinking about the comprehensive family-based family strengthening intervention. And so I'll talk a little bit about Familias en Acción by giving you some highlights. 3 aims. This is a research project and it's part of the P20, which is I guess a sister center to the one here in El Paso. And so what are the aims from our project? 1, to adapt and test a supplemental parent education intervention, and later we called it Familias en Acción. Better than we used to call it parent component. I didn't like that. The difference between parent component and Familias en Acción. Much better, much better. And so the aim is to increase the effect size of keeping it real. But what it is, it's a piggyback approach. We know that keeping it real works, but wouldn't it be wonderful if we had the parent component and it works twice as much, or even a little bit more? And that would be great on these different outcomes, just the same as before, but now how does the parent intervention multiply the effect? Aim 2, to examine the effects of the parent education intervention on family functioning. We want to know that the family improves as it enhances the effects of keeping it real. And the 3rd aim, to examine the moderator effects of acculturation and other cultural variables on the quality of the parent-child relationship, on family function and youth outcomes. Put it another way, these are good things that could happen. Is there a difference by whether we see the early immigrants or the bicultural families or the higher acculturated families? So there's an interesting question, is the program working differently for the different acculturation groups? And I won't go into this, but this is like a parallel to the other that I mentioned. We want to have these ingredients lead to positive outcomes. And let me mention these. These are busy slides. We have 7 workshops that we do with the parents. And no sooner did I have this posted that my project director said, time out. It's different than this because we're finishing the pilot and we're refining these. But this is the original with some adjustments. So if I could give you on another occasion how it's now looking, but it's very similar to this. And I'll just give the highlights and you can see the bullets. Workshop 1. Oops. Workshop 1, knowing your child's world. And who shouldn't know their child's world, right? And what we learned from that is that it's a lot easier to bring up those things, you know, that the stork wasn't really delivering your little sister. It was something else that happened. That it's easier when you have a strong relationship with your child. You can then communicate, and that goes for sex, for drug abuse, for other problems. Where it becomes difficult is where you have a bad relationship with your child. And you know, you have to say, well, vamos a hablar de algo, and then your child says, I've been talking to you for a year. Why should we talk now? You know, what's going on here? So it becomes a barrier. So one of the goals is to work with the parents to build strong relationship with your children so that when you have to deal with difficult topics, it's easier. It's not always easy, but it's easier than if your relationship is very bad. So we need to improve that, and we teach parents those issues. Number 4, managing your child's behavior effectively. We also talk about the different strategies, but here we have behavior management and other ways to work with your child. Workshop 5, promoting your child's academic achievement, parental involvement in the schools. We talk about the lead, the last of the 4 strategies, but also other ways to get involved in school. Number 6, talking with teens about the consequences of drug use and risky sexual behavior. So how can you bring that up and be effective? Many families did want information here. They wanted to know the different prevalence rates locally so they could talk to their kids about what's out there. And we thought that's a good idea because it's information but in the context of other things. Review your own attitudes and beliefs about teen alcohol and drug use. From another study, what we found, when the parents were more permissive at home, as was brought up before, the kids did alcohol earlier and they did it more. So clearly you needed to have rules in the household that it's not okay to do these things. And identify ways to get ready for sensitive conversations. Okay? So here's the parents wanted to know, how do I set things up so that I can talk to my kids about these tough problems? And then finally putting it all together, talking about everything. And again, this has undergone some changes based upon our pilot feedback, but that's the basic curriculum. Okay. So clearly we want to have a nice integrated family that works together and is able to avoid bad things happening to the family. We know easier said than done, but we want to help parents have tools to do this. What works in prevention? I'll only cover this briefly because I know I'm running short on time here, about 10 minutes, and then for discussion we can go back to any of these. But this is from a report from several leaders in the field. Carol Comfort, who I mentioned before, is here, and then many others. And what they did, it was a review panel, so these are best practices. And I just want to give you the highlights of that. 9 principles that apply in 3 areas. If you want to make programs that work, what do you have to do? You have to look at the program characteristics. What's the product that you give, the recipients? Number 2, matching the program to the target population. Dear to my heart, the notion of match client treatment matching, or matching a program that's relevant to the population or to the community as well. And prevention program implementation and evaluation. You need to have what I talked about before, the rigor. You need to do it well, because if you don't do it well, it'll begin to fall apart, and then at the end you don't have much left. What I did here in the little yellow C here, I've included my own thinking to what the panel said, but I just want to get some highlights. Comprehensive program. Remember I mentioned this thing about information only. Give them a pamphlet and say, "Que te vaya bien." Don't do that. Not going to work. We know that. Comprehensive program means you have all these pieces together in a package that has been shown to work. So, and then I added include group relevant cultural factors, and I'll talk more about that in a bit. Number 2, varied teaching methods. You can't do it one way. You have to have a variety of activities so that the kids get involved too. And use, I said, personalismo with traditional Latino groups. That's important to us, right? That you feel like somebody really cares and they're being with personalismo versus a very distant. Sergio, you mentioned about the physician, 5 minutes, tell me what's wrong, here's the prescription, goodbye, and send me your insurance information before you go out the door. Well, that's not personalismo, it's not to me. I want to know that somebody is happy to see you and that they want to see that you're doing better and all that. Well, for us Latinos, I guess we feel even stronger about that. Number 3 of these, sufficient dosage. And by sufficient dosage, I don't mean drug dosage. That's not what I mean. What do I mean? The dosage means enough activities and skills so they can now run with it themselves. And so we need to do that. And I said, consider group-related individual difference in learning. Some people learn quickly, some slowly. You have to take into account the unique person or group. Theory-driven, why is that important? It's just a theory. Well, actually, theory, the good ones are the ones that put a story together about how something really works. And so we need to know that, because otherwise we go the wrong direction. So we need to have that, and they mentioned it, and I agree with that. Next, positive relationships. We've spoken about that already. Improve parent-child relationships, strong bonding. And I said, consider parent-youth differential acculturation, which we know happens. Appropriately timed, and this is a little more in terms of, well, it should be developmentally related, because the program for a group of children 8 years old is different for ones in 10, those 12, those 15. So you need to pay attention to that pattern. Socially relevant, we talk about community norms and tailoring it, so those have to be filtered in. Outcome evaluation, yeah, you need to know, you have to get good outcome, because otherwise you just don't know that it worked. And so many people develop programs and they say, I think it worked because I like it or because I'm doing it. That doesn't mean it really worked. So we have to do that. And then finally, well-trained staff. The point here is that many times the messenger is more important than the message. And you see that, of course, again, with physicians, but we have to do it also with our program staff. They have to be well-trained. They have to be able to connect with the audience. Okay, so let me move on then. And finally, directions for future research. And I'll just give you some highlights here. this is just saying the same thing over again, so let's just bypass this a little bit. A quote here by this, and this, again, I give you the whole reference, so if you wanted to look it up, you could. The quote says, because models for prevention and treatment of substance abuse typically do not consider these and other important cultural variables that I'll talk about in a bit, there has been a call for prevention scientists to develop more culturally rich models. So what are the key cultural variables that we need to think about? In other words, to make it relevant for Latinos. And this is a long list. I'll just mention them. But we have to think of acculturation. We know that this is a process which puts Latinos at risk. We need to incorporate that. This is more for African American. Afrocentricity refers to pride in being black. That came from the civil rights movement, but it's still important. It takes a different twist now. But you know, we saw this recently. How many people, when Obama was elected president, how many people cried because they couldn't believe it and they were so proud to be black that one of their own made it. It was very touching to see that. So this is not trivial for African Americans, although there's variability in how much they actually identify as being black. Biculturalism, very important. We have people that live in two worlds. Cultural flex, what does that mean? Well, people can move in and out. Many of you do this, cultural flex. You go home and when I'll speak for myself, I go home and I can't speak English to my mother. It's like weird. Hablo en español con mi mamá, but then my sister comes in, I go, oh, ¿cómo estás? Or I say, how are you doing? You know, well, I use both. And then as I switch with my wife, I say, oh yes, why don't you make me a tortillita and could you make a little quemadita because I like the crunchy kind. So we go back and forth. You know, that's being bicultural and having cultural flex. There are others that I won't go into, but a lot around ethnic identity formation, very important. Whether people approach the world in terms of outside or inside. These, we're doing some researching because I took a real interest in machismo and marianismo. And the reason I took an interest in machismo is that we do a focus group with señoras in the community, and then we would be asking them about all these kind of things. What do you think works? And no say. And then we said, we want to talk now about this thing that you might be familiar with called machismo. And all of a sudden, all the hands go up. Oh, they had something to say about machismo. And so the issue was, it was a very culturally loaded topic. We need to consider that. And why is it loaded? Because it has a lot to do with the husband-wife relationship. So if we want to promote drug prevention in the kids, we need to take into account the nature of the relationship between mom and dad. You know, there's different homes where somebody rules and other rules and others that are very equitable. We need to understand that, but these are two what we call gender roles that we need to understand how they work. And then there's other things too, and I'll point to spirituality and traditionalism. I think is very important. Okay, so we need to incorporate those, and I won't go into this. These are just different models that the point, let me go into this one. What we're trying to do, it's very busy, but the idea is the two things we want to do is improve family function and improve family social ecological relationships, like with the schools and with the community. And if we can change these two things, we can reduce marijuana use. And then these are the measures we have to try to get at those changes. So we need new directions. The other point that has been made by David Satcher and Higginbotham, remember who was David Satcher, or who is David Satcher? He's former Surgeon General, right? Very important. He's been very active actually in continuing in the public health arena. And he has made a big pitch for multi-level programs. That is, programs that are done at the level of social policy, but at the same time, community activity, and at the same time, family activity and individual. So you're dealing with all levels. Very hard to do, but that's where partnerships are very important because you have coverage across the board. And I think you had, I think, a slide about we're never going to change an epidemic by dealing with the individual, or something like that. I mean, the individual is very important from personalismo. We need to win them over, but the bigger epidemic is all over, so we need to deal at all levels. This is the big challenge for today. Having programs that are multi-level and not just the individual. Or the other thing is changing a policy, very important, but it doesn't filter down often at the daily life experiences of the individuals. So these are just continuing to talk about environmental interventions, community consciousness, creating partnerships. Again, the theme of multi-level. I think this is my last, oops, one more slide here. Well, in summary, I can say it. In summary, we need to take a carefully thoughtful a thoughtful approach to drug abuse prevention that takes into account the different trajectories and the different levels. What does that mean? Policy, very important, of course. Community is important. Family is important, and the individual youth. And we have to make programs that address all of them together in partnerships, because one person, one group cannot do it alone, for the purpose of having a real impact. And with that in mind, it's not easy, but together, como dijo Cesar Chavez, juntos si se puede. So we need to do it together. Thank you.